The FDA is not recommending booster shots for most Americans. However, health officials are recommending doses for 65 and older and those who are considered high risk. So joining me now is Dr. Melanie Swift with Mayo Clinic. Good morning, Dr. Swift, and thank you so much for joining us.
Glad to be here. Thank you.
Well, let's start with something simple. What is a booster and why do we need boosters for vaccines?
It's really important at this stage that people understand the difference between that primary vaccine series, which is more than one shot, and a booster that is something you get later. So think of it like painting your house. The can of paint may say you need 2 coats of paint, but some people may need 3. So the number of doses that people need for those mRNA vaccines might be 2 or it might be 3 for some people. Once you've had that primary series, your immune system has responded the best it can. Over time, that immunity could wear off, or the virus itself could change, such that you need another dose later down the road. And that dose later is a booster shot.
So what is the difference between a booster and a third dose for those previously told how that they could qualify? How is this any different?
The people who are needing that third initial dose are people that are immunocompromised, and their immune systems don't respond as well to dose 1 and dose 2 as young, healthy people's immune systems respond. So they actually need dose 1, dose 2, then dose 3. Going forward, that dose 3 is not going to be spaced far apart. It's going to be 28 days after dose 2. So immune compromised people will get dose 1, then dose 2, 21 or 28 days later, and then dose 3, 28 days after that. That's their primary series now. Then down the road, 6 months or more later, they may need a booster. And right now, it's just the timing of how the vaccine rollout happened that many of those people are getting that third dose now because we didn't know last winter and spring that they would need a third dose.
And right now, do we know if boosters will help stop or control breakthrough infections that we've seen with the Delta variant?
That's the big question that is still on the table. The FDA panel that reviewed the data yesterday reviewed data from the company, Pfizer, but that data was very, very limited and really not the primary basis for the recommendation. That data didn't look at who got sick after getting a booster or not. It was just looking at lab tests of a very small subset of people in their clinical trials. In fact, the data from Pfizer only included 12 people who were over 65. And it just shows what their blood did in a test tube after a booster. And while that looks promising, what we really need to know is how well do these vaccines last at preventing hospitalization and death. And it looks like they last quite well for that. The data from Israel was probably the most compelling data that supported boosters for elderly people. And the committee is still very concerned about needing more clinical data, outcomes in people who are younger, because it's very clear, and the CDC members on the panel made this very clear yesterday. What's fueling the pandemic are people who are unvaccinated. Our path to ending the pandemic is not really through boosters, it's through initial vaccines and people who remain unvaccinated.
And thank you so much, Dr. Swift. That is unfortunately all the time we have right now, but I want to thank you again for joining us this morning and answering these concerns about booster shots and the vaccine.
Thank you for having me.